So one of the questions that I keep getting asked is, what are some biotech or pharmaceutical stocks that are currently trying to kind of fight or treat this global issue that we're currently going through right now? Well, in today's video, I'm going to list for you guys the 5 stocks that I'm probably the most aware of myself that kind of fit that criteria. And I'll teach you guys a little bit about who they are, what they're doing, and of course, I'll give you my personal opinion on each one of them as we go through the list. Now, just a quick disclaimer, I'm actually not the biggest fan of the pharmaceutical industry. Not only am I a little bit more of a natural health kind of guy, but I also just don't feel knowledgeable enough to be investing heavily in it. And I also feel like a lot of biotechs tend to be a little too speculative for my taste, especially right now with how shady the stock market is. I'm just kind of being a lot more cautious and strategic with my purchases, sticking to more reliable and stable companies out there. Now, having said that, I do actually own a biotech kind of pharmaceutical stock myself in AbbVie, which is a stock that I mostly purchased for the dividend and the valuation, which I found to be very attractive at the time that I made those purchases. But other than that, I'm just not a huge fan of these type of stocks. So just kind of want to give you that heads up. I probably won't be buying any of the stocks on today's list, but I'm mostly just kind of doing this video for you guys because it's something that a lot of you requested and you wanted to hear my opinion on these type of stocks with everything going on. So I hope you guys can understand that, and I hope you enjoy the video nonetheless. And if you do, please consider hitting the like button because it really helps the channel and it means a lot to me. But we've got a lot to cover, so let's go ahead and start things off here with stock number 1. And this is in no particular order, but that's going to be Moderna. And I know I'm pronouncing that wrong, but ticker symbol is mRNA. And this is actually a biotech company that is developing a new type of V-shot to deal with this global issue that is going on right now. But they're using new technology that has the potential to be much more efficient than anything else that is currently out on the market already, or that their competitors are developing. See, traditional V-shots are protein-based, but lately there's been growing interest in gene-based shots that use DNA and RNA, the latter of which Moderna is using for their mRNA technology platform, hence the ticker symbol mRNA for the stock. And while this is still experimental technology that is in the early stages of human trials, they claim that the potential benefit is that it could be the best performing, most efficient V-shot on the market, taking just weeks to develop, whereas traditional ones typically take months, making these easier and more cost effective for mass production. By the way, I know V-shots are a little bit of a controversial subject these days on the internet with a lot of people kind of fighting. I'm not sharing any kind of personal opinion on any of this. I'm just telling you what Moderna is doing, so please just kind of keep that in mind. In any case, I believe Moderna is the only company with an actual mRNA shot in clinical trials right now, having already begun human trials in March, which is incredibly fast. And so the only real competition for them are those using DNA or protein-based technology, which we'll talk more about in just a second, but some would argue that this ultimately gives Moderna a competitive edge in an otherwise heavily crowded market, as there are currently over 70 different shots in development for this specific global issue alone. But because of the urgency of our current situation, the US government has granted nearly $500 million to Moderna to help fund their development. As a result, their CEO recently said that they may be able to have the shot available for emergency use as early as the fall in a worst case scenario, and widely available in 2021, which would also be very fast. This is big news because if the product is successful, it may also help validate Moderna's pipeline of more than 20 different products, all of which are currently undergoing trials using the same mRNA technology, which is also important for their finances, as I don't believe Moderna has ever released a drug or V-shot to the market, and that's led to them losing hundreds of millions of dollars per year in recent history. Still, all the excitement has led to this spec stock soaring in recent months. Now, they only recently IPO'd, I believe in 2018, and throughout that time, the stock has typically traded for around $20 or less, but this year alone, given everything that's happened, the stock skyrocketed by over 145%, leaving them now trading very close to a record high. Unfortunately, it's also led to a soaring valuation with a gigantic price to sales ratio that is close to 300 and over 5,000% higher than the sector median on a trailing basis. Very interesting stock that I probably will enjoy tracking, but unless I was looking for a biotech speculative stock, which I'm definitely not, there's just no way I can be buying at these current prices. Okay guys, moving on to stock number 2, might as well cover a direct competitor to Moderna, and this is another company that is actually developing a DNA-based V-shot, except I don't believe, from my understanding, I don't believe they're using RNA technology, just DNA, but they're still getting a ton of attention, and this is a company called Inovio, ticker symbol is INO. Now there's several reasons why investors are excited for Inovio's products. For one, they are relatively simple, making them easy to develop and manufacture, and perhaps also safer than other options, as they claim that the majority of their products only use highly purified DNA, water, and some salt. Another reason is that Inovio has experience in developing V-shots for other issues, with their INO 4700 shot showing some success in treating another version of that global issue that we're currently facing, and is further along in the trial phases, leading to optimism that their new INO 4800 shot will be a success. And the result of that experience, coupled with their technological advancements, is that they were able to create their new shot in just 3 hours. They've already started human trials right along with Moderna, and they're even planning to produce as many as 1 million doses by the end of this year, which would be crazy fast, although I believe that just like Moderna, that would mostly be used for emergency cases only, while 2021 is looking more likely to be the year where they scale up the use. Still, being one of the earlier developers of a shot could be a big opportunity for Inovio. When trying to estimate the potential market size for such treatments, the Motley Fool took just half the population of the European Union and multiplied it by $700, which is about $100 less than what a similar shot goes for these days, and they came up with a hypothetical market size of almost $18 billion just for Europe alone. And if it were to become a seasonal issue, then this could mean a lot of recurring revenue for companies like Inovio. I will just note though that the FLU market seems to be much smaller than what the Motley Fool is estimating for this one, as Fortune puts it at only around $7 billion by 2026. Regardless, the opportunity for sales is something that Inovio desperately needs, as just like Moderna, they continue to lose millions of dollars every year, and it's only been getting worse in recent years. Unfortunately, this new potential has been getting baked into the stock already, as it is currently up over 170% in just the past few months after trending heavily downward in recent years, so it's a pretty wild stock overall. And just as wild is the valuation, with a PS ratio soaring to over 200 in recent months. So another spec stock here, you guys know my feelings on those. I definitely won't be picking up any shares myself, but it's another one that I think I probably will enjoy tracking, and it should be interesting to see what kind of progress they make over the next few years. Okay, now at this point, I'm gonna assume that you guys are probably getting tired of only talking about spec stocks. So for stock number 3, we're still gonna talk about another V-shot contender, but this time we'll talk about a company that is much larger, very well diversified, and a very profitable company as well, and a stock that I think most investors would generally consider to be a relatively safe stock over the long term, and that is, of course, Johnson & Johnson. Ticker symbol is J&J. Now, I'm sure you guys know about this one, as they are the conglomerate behind very popular brands like Listerine, Band-Aid, Neutrogena, Aveeno, Johnson's lotions, powders, and liquids, and even AccuView contact lenses. However, what a lot of people don't realize is that J&J also has a very large biotech and pharmaceutical division that develops a number of pharmaceutical products like Tylenol, Motrin, and Benadryl, as well as stronger medicines and even V-shots, which they are currently working on for this global issue. According to CNBC, they're aiming to produce as many as 900 million doses by the end of the first quarter of next year for emergency use cases. That's obviously much later than what Moderna and Inovio are doing, given that they're not even scheduled to start human trials until September. But while Johnson & Johnson might be late to the party, they have the scale and reliability needed to have a significant impact, with over $1 billion being invested into the new shot, which is also backed by the federal government, and the result is that they will aim to produce over 1 billion doses annually. Still, what really sets Johnson & Johnson apart from the rest is that this is by no means a speculative stock that is so heavily reliant on this one single product. Now, it's true that they just reported their first quarter of 2020 and were forced to lowered their outlook for the full year, expecting a negative drop in sales given weaker demand for their medical devices as less people are having procedures and surgeries done right now since everyone is on lockdown, staying at home, and avoiding the hospital when possible. But it's also true that they beat estimates on both the top and bottom line for the quarter thanks to higher sales in their consumer health and pharmaceutical businesses that grew by almost 10%, which shows the advantages of having a large diversified business. As a result, they were even able to increase their dividend at a time when most other companies have been cutting it. And despite the lowered guidance for the year, they're still expecting close to $8 of EPS after having consistently brought in billions of dollars of free cash flow in previous years, with almost 20 billion last year alone. So, a very profitable company through and through. And that large cash flow helps them continue growing their very reliable dividend that has grown for an absolutely massive nearly 60 years in a row and still yields over 2.6%. Unfortunately, the best time to buy this stock was back in March when it was considerably cheaper and also wasn't trading for almost a record high, but even still their PE ratio remains a bit lower than the sector thanks to a number of lawsuits that have hurt the company's reputation and kept the stock suppressed at more reasonable levels. Still, it's just not a company that excites me enough to be purchasing at these higher levels, and I've definitely bought a lot of new stocks in 2020, so it probably would take a lot to get me interested enough to be buying another new stock and adding to my portfolio. So I'll probably be staying on the sidelines for this one, but again, out of the stocks that we've talked about so far, definitely the least speculative, very well diversified, very profitable, and it is a stock that I will continue to track, and it's a stock that I do respect for those different reasons. Okay, now we've definitely talked a lot about V shots, but what about treatments for kind of carrying us over until those shots come out? And then also, what about tests, which are very important for reopening the economy? Well, the next two stocks are going to be focused on exactly that. And starting with treatments, that's going to be a stock that has been pretty hot lately thanks to their new promising treatment for this global issue, and that is none other than Gilead Sciences. Ticker symbol is GILD. Now, back in the day, this was one of the top pharmaceutical companies in the world that was also seeing a ton of growth thanks to a number of major acquisitions, which I won't go into detail here, but you can see on this screenshot how many companies they were acquiring to launch a very large range of products to treat a wide variety of illnesses and diseases. Fast forward to today though, and the stock has crumbled from their highs that they reached back in 2015, mostly because of an increase in competition that led to sales falling almost every single year since then. So far this year though, the stock has rebounded by over 20% thanks to promising results of one of their already existing drugs that you've likely heard of. I'll just refer to it as REM, as a possible treatment for this global issue. According to US News, preliminary data from 2 clinical trials using the treatment on patients with either moderate or severe symptoms showed that a number of them fully recovered and were later sent home. This obviously dealing with the current issue that we're dealing with. Only time will tell though how effective this treatment will ultimately become, but given that it's not a preventative treatment but rather a treatment to deal with symptoms, I'd assume that the market won't be very large once V shots come out and there are other therapeutics in the market to compete with. Then again, it could be a while until a shot comes out, and in the meantime, cases continue to climb. So at the very least, this may be a treatment that is desperately needed right now, and whatever bump they get in sales, which by the way, I wasn't able to find very reliable data to make any kind of estimate on what kind of sales they would see, but it would likely be a welcome bump given the horrible recession that we're currently going through and how Gilead would need that sales growth. Still, Gilead bulls would argue that investors should really be focused on their lucrative programs and growing pipeline more so than this one product. Biktarvy alone, which is an HIV drug, did almost $5 billion in sales last year after quadrupling from the year before, and is still expected to grow to over $6 billion by 2024, according to Evaluate Pharma. There's plenty of other products in the pipeline that I don't have nearly enough time to cover in this video, but they cover various areas like oncology, V's, inflammation, and fibrosis, several of which are believed to have blockbuster potential, which they will desperately need to reignite the growth that they've been severely missing in recent years. Now, the company also pays a very attractive dividend, currently yielding well over 3%. And when you couple that with the potential of the REM treatment, the growing pipeline, and the reasonable valuation that is around 40 to 50% cheaper than the sector median, it makes it understandable why investors have been buying the stock this year. It's still not a stock that excites me enough to invest in myself, but I definitely will be keeping an eye on them, and I hope that their REM treatment is successful in helping people. And obviously, that goes without saying for all the other things that we've talked about in today's video. All right, guys, finishing up here with stock number 5, we got to talk about testing. And when it comes to testing for this global issue, there's really no other company or stock that I can think of that has been getting more attention than ABBT Laboratories, and that is ticker symbol ABT. And this is actually the old parent company of AbbVie, which is the biotech stock that I own, before they actually spun them off. But when looking at ABBT, they're a very large and pretty well diversified biotech company that not only sells pharmaceutical drugs, but also nutritional supplements, medical devices like heart pumps and chronic pain devices. And they're also a leader in medical testing with a number of blood and plasma screenings, glucose monitoring, point of care testing, and what has got them the most attention recently, testing for this specific global issue. Now, back in March, they launched their second test for it that can give back positive results on their patented ID Now platform in as little as 5 minutes, which is crazy fast. The hardware system itself is about the size of a toaster, making it very portable and easy to use by most hospitals, doctors, and even pharmacies. In fact, the HHS, CVS, and Walgreens have all partnered with ABBT to offer the test in drive-thrus for the general public. But the molecular tests are not the only ones that ABBT has launched. The third test that they released just this month is a new antibody test that is claimed to have almost 100% accuracy, and it should be a very crucial test for reopening the economy, as it makes it easier to figure out who is immune and should therefore be working. But as if all of this wasn't enough, ABBT is actually working on a fourth test that is being built to be a mass scale test for the general public, aimed at assisting with the reopening of the economy efforts. And while I couldn't find any reliable data on how much revenue ABBT will be generating from all of this, I think it's pretty safe to say that testing will be a gigantic component of the future in how we deal with these type of issues and how we go about reopening economies. So while the shutdowns and the continued social distancing and general fear of going outside will almost certainly continue to hurt ABBT's performance this year as less medical procedures are being done, I think a lot of investors are assuming that the huge ramp up in ABBT's new tests should help them offset some of those losses and help them get through the recession. For example, they're already planning to ship over 4 million units of the antibody test this month and then scale up to a monthly rate of about 20 million by June, which is a huge amount. Either way though, ABBT is generally a well-performing company that grows both their sales and profits in most years and also pays a decent dividend that only yields 1.5%, but has at least grown for almost a massive 50 years in a row if you don't count the year that they spun off AbbVie, which shouldn't really be counted. Unfortunately though, the stock is currently trading near record highs, which is something that deters someone like me who loves to buy stocks when they're actually falling. And after having climbed by almost 100% over the past 5 years, their PE ratio is also way too high for me at almost 50 trailing and 60 forward. So it's going to be another no touch for me because of that valuation. But there you have it, guys. 5 biotech stocks that are directly fighting this global issue. What do you guys think? How would you rank these stocks? Or do you own any of them? Are you interested in any of them? Let me know down in the comment section below. Again, none of them are biased for me, but if I had to rank them from best to worst, I would for sure go with Johnson & Johnson at number 1 because of the low valuation, the solid dividend, and their solid diversified business. Gilead and ABBT Laboratories probably gets tied for second, although maybe Gilead has a slight edge because of the lower valuation. But at the same time, I like ABBT's business a little bit more. I feel like they have a much more stable business, but that valuation is very high for ABBT Laboratories. But both of them seem pretty reliable for the most part, and they also have solid dividends. ABBT has the bigger track history of the dividend, but then Gilead has a higher yield, so that's kind of a toss-up too. So they pretty much get tied for second for me. And then finally, the 2 spec stocks would just kind of finish off the list. Not really interested in spec stocks, but if I had to choose between both of those two, I'd probably go with Moderna over Inovio because of the RNA technology. Anyway, that does it for the video. I hope you guys enjoyed it. By the way, I'm sorry if I sounded a little tired in the video, recording this pretty late and I haven't gotten any sleep. So I just had a lot of work and a lot of stuff outside of YouTube that I've had to deal with lately. But anyway, I hope you guys enjoyed the video. Thanks again for watching, and stay safe out there. Take care. I'll catch you guys in the next one. Bye-bye.